30 years after the International Conference on Population and Development, where are we today with comprehensive sexuality education? Discomfort with and resistance to CSE is not new. What is new is that it is now better organized, increasingly well-funded, and more assertive. It is also part of a globally connected pushback on various aspects of sexual and reproductive health and rights. Here is an extract from a document titled False Pretenses: The Anti-Comprehensive Sexuality Education Agenda Weaponizing Human Rights, published by IPAS last year. It says, despite CSE's proven positive impact on the sexual and reproductive health and rights of adolescents, there is a growing movement opposed to the curricula based on moral and religious grounds. WHO is working with partners within and outside the United Nations system to stand up to these attacks on CSE with good science. Here is one example. In 2019, the Institute for Research and Evaluation, a USA-based think tank, published a report titled Re-examining the Evidence for Comprehensive Sexuality Education in Schools, a global research review. It concluded that 89% of international school-based CSE programs that measured the evidence of effectiveness failed to demonstrate it. In a nutshell, the vast majority of CSE programs being implemented and included in reviews were not effective. We did a careful reanalysis of the Institute for Research and Evaluation report. We published a detailed analysis of our findings in the Sexual and Reproductive Health Matters Journal and a commentary in the Journal of Adolescent Health. Our conclusion in the SRHM journal is as follows. Overall, our reanalysis reveals that the IRE review suffers from significant methodological flaws and contains many errors which compromise its conclusions about CSE. Bad science. And in our commentary, we went a step further. We said that at best, our findings indicated that the IRE analysis lacks the rigor necessary to inform any recommendations on CSE programming, and at worst, which is our suspicion, the report intentionally downplays the effectiveness of CSE interventions to support the author's ideologically driven stance against CSE. To extend the support for CSE, WHO has been working with partners within and outside the UN system to engage political leaders, government officials, and public health professionals. In this particular initiative shown in this slide, we reached out to 5 medical and professional associations at the global level listed on this slide and invited them to consider publishing statements of support for CSE. We were overwhelmed by the response. Each one of them has published these statements, and they are now in the process of putting together a joint commentary for publication in the Bulletin of the World Health Organization. You will find each of these statements in the blog post published by the Sexual and Reproductive Health Matters Journal. Thank you and namaste.